Hello friends, let's today talk about Genu Valgum or knock knees in kids. If your child's knee, they touch each other while standing, but feet they stay apart, don't panic. This condition is called as Genu Valgum or knock knees, but it is not always a pathological condition. Good news is that it is a normal part of growth, and after the age of 8, it almost improves itself. So what exactly is Genu Valgum? See, if the appearance of the legs is like X, English alphabet X, in which both the knees are close to each other but the feet are apart, then this condition is known as Genu Valgum, and it is something very common in children. Normally, all the kids have little bit of Genu Valgum to start with. Around the age of 2 to 4, all the kids they develop Genu Valgum, and maximum appearance is seen around the age of 5 to 7 years. Good news is that almost by the age of 7 to 8 years, it automatically corrects itself and it becomes normal. Now, when should it be a concern? It is a concern when it is a severe deformity, or when one leg is affected more than the other, or if the condition persists or worsens after the age of 7 to 8 years. Sometimes the child may develop pain, limp, or difficulty in running because of this. Rarely it can lead to shorter stature or delayed growth also. Very rarely it can lead to fractures, especially when it is associated with nutritional deficiency or metabolic disorders. Normal causes for abnormal Genu Valgum includes vitamin D deficiency, or more commonly known as Rickets. Sometimes it is more persistent in childhood obesity. Rarely it can happen when there is a growth plate injury while playing. Growth plate is the area of the bone that grows normally when the child is growing in length. Rarely it can happen in metabolic conditions or skeletal dysplasia, or sometimes endocrine problems also. A majority of parents think that it is because of W position sitting. No, this is not true. A lot of kids they sit in W position, but it never leads to knock knees. In situations where it is not improving with age, or it is abnormal, or if it is causing trouble to the child, we do required investigations also. Normally, required investigations are in the form of X-ray and serum vitamin D test. With regular follow-up, if the X-ray is showing that there is rickets, or if the vitamin D level in the blood is very low, in majority of the cases we start the child on vitamin D and calcium diet, and that takes care of it. We keep the child in regular follow-up. Sometimes even after regular vitamin D diet or repeated X-rays, if the child's condition does not improve after the age of 8 years, we might require a detailed follow-up for endocrine problems or skeletal dysplasia or metabolic disorders. If in spite of everything, the deformity persists and the child keeps on growing, rarely we need to do surgeries also. These surgeries are basically of two types. If required, we do temporary growth related surgeries where we selectively modulate the growth on the growth plate. This is known as growth plate stapling or growth plate pinning surgeries, which are done selectively to correct Genu Valgum deformity. Second type of surgery is corrective osteotomy, in which we cut a part of the bone, we remove a wedge, and we straighten up the alignment of the knee joints. Normally these surgeries are never required. It is only required if the walking pattern is abnormal, or there are frequent falls or frequent knee pains, or we expect that the child will have excessive stress on the one side of the joint in the adulthood. Then only these surgeries are recommended, especially if nothing else is working. So the take home message here is most children with knock knees are normal, and this is known as physiological knock knees. However, if there is severe, asymmetrical, painful, or persistent deformity after the age of 8 years, then it should be definitely evaluated. Or if your X-ray is showing sign of ricket and vitamin D is low, then definitely it can be corrected with vitamin D rich diet. However, if the deformity persists after a certain age, then surgeries for correction are available, which should be done to discourage any sort of joint abnormal loading in the adulthood that could lead to early arthritis. All the best.